So we're here to do a dressing change for a PICC, and the first thing I'm going to do is make sure I have all my supplies. So I've got a dressing change kit, I've got a flush and a new cap, I've got the green caps so that I can replace this with a green cap on the new cap. I've got the correct dressing as well. So the one that comes in the kit is pretty poor quality, so we like to see this one. It's got a cloth border, it's got a designated exit site and reinforcement for that exit site. Here's the number 1616. If you guys don't have those in your department, try to get those requested as part of what you have. And then obviously I'm going to have sterile gloves in my size. I'm also going to bring an alcohol swab. The next thing I'm going to do is I'm going to make sure I get myself set up and the patient's arm set up in a way that it makes it easy for me to do this, because if I'm having to fumble around in an uncomfortable position, that's going to be when I'm going to make errors. I'm going to compromise my sterile field and such. So just take your time to get set up in a way that's going to help you out the most. So let's start by changing the cap. I'm going to pull this off and I'm going to inspect the hub here. And so what I'm looking for, I'm going to go ahead and just throw that away. What I'm looking for is any blood crusted around here or just crusties on there. And I'm going to get myself set up so that I don't touch the cap to the patient's skin or the blankets or anything around me. And you'll see that it kind of wants to sit up like this. I'm going to take alcohol and I'm going to really clean that off. If there's blood crusted down in there, I can even use my swab and get in there and clean some of that out. The important thing is I clean this off well. And if there's a lot of crusty blood, I might need to use 2 swabs, but I'm going to do that and then I'm going to let that dry completely. So I'm going to let that sit there and dry. The reason is if I don't allow it to dry enough, when you go to put this new cap on, it's kind of going to glue itself on there. You soften that polyurethane, that the plastic that the PICC is made out of a little bit when you use alcohol on it. And so flushing my new cap. And when I go to put this new one on, if I haven't allowed it to dry completely, it can somewhat weld itself on there and be difficult for the next person to take off. So I'm going to apply that, flush vigorously, pulsatile flushing. I'm going to check, do a little quick flush, check for blood return. I should be able to see it come up into here. And then flush, hold pressure. This one's going to squirt the camera if I try to flush through it, so I'm not going to actually flush it, but I would hold pressure and then remove this. And then I'm going to grab a new cap. And there you have your chlorhexidine impregnated cap over here. Okay, next thing I'm going to do is I'm going to get set up to be able to change the dressing. I'm going to start by opening my packages and have them ready to go so that when I open the dressing, I'm not having to do this part and allow that to stay open for a long period. So you want to carefully open your dressing change kit so that you keep everything inside sterile. Set that in a spot that's convenient. So I have tried various methods of dropping this dressing onto my field, and I've come to the conclusion that the best way to do this is simply to open it and have it set up here, ready for me to pull it out by folding it down, and then I will really push down hard on the sides, not touch the middle, that way I can secure that as I pull it out when it's time to do the dressing change. I'm going to just get my gloves out of the plastic, set them here, and I'm going to peel this away. So I have my label over the top of this. I'm going to have to peel that back first. And of course, anytime you handle a PICC, you're going to use clean gloves. And I would have done hand hygiene prior to donning the clean gloves. I'm going to get rid of that. Now I need to peel this way because this goes under the PICC and over the top of the main part of the dressing. So I'm peeling that out. Both of these can go in the garbage. Now I'm going to start at the exit side of the PICC and peel my way towards the biopatch. The reason is that I want to treat two things. I want to treat everything underneath the dressing as sterile. And if I peel this in one direction, I don't touch anything under there. And then also I can peel the biopatch away with the old dressing as I peel it towards the insertion site. There we go. So that's all away. So I've got a section here that's non-sterile that we're treating as non-sterile and a section that's sterile. So now I am going to don sterile gloves. That. I already have a mask on, but if I didn't, there's one for me. So I'm going to create a sterile field here below the PICC, right up against the patient's arm. We have a shiny side and a dull side. The dull side is going to face up. That's the absorbent side. And I'm going to just kind of tuck this in here. Stay. So I'm going to use these gloves that come in the kit to help me out. Oh. Can you roll the patient's arm away from me and I'll tuck this under? So sometimes you just ask the patient to move their arm a little bit so that you can tuck it under. That's helpful. So we've got the gloves that came in the kit. I'm going to use these. First one is going to go over the top of the PICC. The second one I'm going to create a pouch out of, and this is going to be my sterile pouch that I tuck the non-sterile part of the PICC into. So I've got the fingers tucked into the palm of my hand here, and I've got the cuff rolled down over my fingers and over my thumb, and then I make a little receptacle here. I'm going to grab the PICC using this sterile glove, and I wrap this pouch around it, toss that glove away, roll this down. I want to try to keep all of this off of the patient's arm while I unbuckle the stat lock. Now I can roll this down the rest of the way and set that down on my sterile field. Next thing I'm going to do, get the alcohol swab sticks, open my package, and you want to saturate the stat lock with the swab stick. You can start from the top like that, and then start an edge, and then use the swab stick. You see how I'm kind of sawing underneath that and getting that glue to dissolve, the adhesive to dissolve. I might even have to switch to a new one here. There we go. Okay. So next thing is I would crack the chlorhexidine swab stick here. I'm not going to do that because it's going to make this really wet and take forever to dry, or won't dry at all. But I'm going to rub this all around the insertion site, under everywhere that the dressing was and the new dressing is going to be. Clean really well. So I want to scrub for 30 seconds. You can sing happy birthday a couple of times. I usually just count to 30. And then I also want to allow that to dry completely. So the importance of allowing this to dry completely are two things. That is how the action of chlorhexidine works, is when it dries, it actually does its antimicrobial action. The other thing is, if I don't allow it to dry, this area underneath the PICC dressing, We found that when you apply the skin protectant and the adhesive on the dressing, if it's not dry, the chlorhexidine will react with either one of those and cause a chemical burn to the patient's skin. It oftentimes is thought that it's an intolerance to chlorhexidine. Usually it's a chemical burn from not allowing the chlorhexidine to dry. So I'm going to dump this out and be ready. Go ahead and dump out my BioPatch, and while we're letting that dry, let's look at, this is the dressing that comes in the kit. As you can see, there's no paper border. It's a pretty lightweight, flimsy dressing, so we're just going to get rid of that. So here's my skin protectant. So that is that barrier that I want to apply to the skin. That's going to allow the dressing to stick a little bit better to the patient's skin and also allow it to release better when it's time to take the dressing off. So I'm going to pull that out, and I'm going to clean the area, basically apply this to the area where the stat lock's going to go first. Then I'm going to try to get all around the areas where the border of the new dressing are going to go. I'm going to not go over the insertion site itself. I'll get close, but I don't want to go right on top of that insertion site. Just want to make sure that I have that applied well. Again, you want to let that dry. And usually, once my fingers stop making that sound, it's dry on the patient's skin. It won't be tacky anymore. So there we go. I'm going to take my stat lock. The arrows point towards the insertion site, so it's going to apply like this. I am going to pick this back up. Now, if you look at the PICC itself, so here it says 4 French, Power PICC Solo. This one happens to not have a clamp. That's one of the ones that we put in. It's a Solo 2. That means it's got a valve inside there. And if you see a barred, that is the underside. So this should be up, that should be down. So that's going to be the surface that goes in here. It's not going to fit right if you try to do it this way, because you see how it's rounded here and it's flat there. So I want to put this inside, get the posts lined up, give myself a little room. So I need to get the posts lined up with the holes, and the posts do float around on these stat locks that come in the dressing change kit. So just have a little patience getting that lined up. So I want to snap those in before I apply the stat lock to the patient's skin, because otherwise you're pushing down really hard on them, which can be painful. The other thing is I want to make sure these wings are folded out so that I can conveniently pull the little barrier away. So lay this out how I want it. Sometimes you may want to turn a little bit. Just depends. If this is pointing directly at the patient's elbow, you don't want them bending their elbow right at the PICC line. So I might turn it just a little bit. So I'm going to put this here like that, peel away, stick that down. I'm going to go ahead and straighten this out, take that off and get rid of it. And I'm going to peel this away. And I just want that to look nice and neat, adhered everywhere. Okay. So the next thing I'm going to do is get my BioPatch. So this also has arrows on it. You see how there's arrows on the surface pointing towards the notch in the BioPatch? That means that this wants to go towards the line. This little donut, the hole wants to go around the insertion site, and the slot wants to go right on down on the skin on either side of the PICC line itself. That way, you don't want to turn it. That way, when you peel the dressing off next time, this comes off with it. If it's turned around, you're going to dislodge the PICC, and we don't want to do that. So this is also a good time to assess my PICC for how far out it is. I can see a 0 right here. So the 0 on the PICC line indicates that is a PICC that, if it's right at the insertion site, that would be a PICC that was inserted at 0. The first hash mark will be 1 centimeter, and then it goes in 1 centimeter increments to the first number after the 0, which is 10. So that's how you decide how far out a PICC is. If I'm at the 0, I'm 0 out. This hub right here, this spot at the end of the light purple line, that is not 0. So you shouldn't be measuring from there. It should be based on this and based on hash marks. I'm going to say that I'm right at -1, so that's what I'm going to write when I document this. And I'm also going to look at how long the PICC was originally when inserted. So if this was a 39 centimeter PICC when inserted, 38 centimeters was inserted into the patient. So 1 centimeter distal to insertion site, 38 centimeters proximal to the insertion site, for a total PICC length of 39 centimeters. So now I'm going to grab my new dressing. I can touch that spot because I didn't touch it before with non-sterile gloves. There's my new dressing. And peel this away. So it has this paper border on it until we get it applied. I'm going to start down here at my bio patch. Make sure that's inside the window and get that stuck down. Now I can bring my PICC out through the exit site. Notice how it's got a little bit of a curve there. And this paper border, you see how it's kind of holding it up and keeping it from contouring to the patient's skin. So I want to peel that away once I've got this started to adhere to the patient. That way it'll allow it to lay out a little bit better. So I'm gonna just try to get this down as neatly as possible. Try to keep the Statlock wings inside the border of the dressing. There we go. I'm exiting right at that little notch. And the next thing I'm going to do is separate these, save that. So I'm going to take this and I'm going to fit that under there like it was before. So break the paper, just like I had on the Statlock. I had that backing that allowed me to put it on the patient's skin before getting the sticky stuff rolled out. So here we go. Roll that out nice and neatly. And again, nice and neatly. I'm trying to minimize that opening. I'm also securing this end of the dressing. This is where you're going to have most leverage on this dressing, obviously, because this will move around. So I definitely want to have that nice and secure. And there we are with that part. The next thing is the label itself. I'm going to put today's date, 10/30/20. I am going to indicate that this is a PICC line, PICC, my initials, because I did the dressing change. And again, that amount out, I said I was -1 centimeter, so I'm going to put -1 cm. So that's the amount distal to the insertion site. And then apply a new label onto the dressing. So again, the date I'm putting on here is the date the dressing was changed, not the date the next dressing change is due. The next dressing change should be due 7 days after this one.